The GHA offers general practitioner house calls for patients who are unable to make their way to the primary care centre because they may be bedbound or other reasons. The start of 2020 was pretty normal as far as GP house calls were concerned. There were a total of 874 house calls in January, February and March, just slightly more than the 867 cases in the same 3 months of 2019. But the start of 2021 was an extraordinary time. Gibraltar entered the year in lockdown, and at the peak of the second wave on the 8th of January, Gibraltar registered over 1,300 active cases. Over those first 3 months, there were a total of 1,147 house calls, a 30% rise over the previous year. In January alone, GPs carried out 421 house calls, an increase of 20% from the previous year. Speaking to GBC, Medical Director Krish Rawal said the lockdown and the peak of the pandemic were very likely to be the direct cause of the increase in the number of GP house calls, especially in January. During that second wave, the primary care centre was operating a limited service, so patients weren't attending the health service as normal, and many of them who needed medical attention might have relied on house calls to avoid visiting the PCC and risk being contaminated. Conversely, though, GBC understands that the number of night calls during this time went down significantly. To book a house call between 8 and 11 a.m. or between 2 and 4 p.m., you can call 200 72429. For out-of-hours house calls, the number is 200 77003.